If you want to ask something, there is a microphone up here. Please feel free.
So with this much diversity, I'm assuming with a child, especially with autism, to start delivering this, it would be an extremely small amount to begin with, correct?
Well, it all depends. It depends on body weight, it depends on previous conditions. It is always my recommendation, even though I'm not treating patients now for several years, to start with a cautionary approach. And there is a reason for this. Autism, fortunately, is not like cancer. In cancer, you cannot wait, you cannot lose time, and if you overcome a certain point of no return, it's a big issue. Not the same with autism. So if you make a mistake, you simply waste money and time, but nothing irreparable occurs. So, since this approach is very strong, my suggestion, and then of course it will be the doctor who considers my suggestion or not, my suggestion is to start with a very low dose, whether of the probiotic or other approaches, and see how the organism reacts. It is so powerful, there are so many microbes that you don't want to overload the system. So that's why start with little and see what happens, and then you can increase.
Right, I'm thinking about specifically die-off and how extreme it could be. So what's a typical dose that you would say to give maybe a child that does not have autism? Do you have a suggested realm?
Well, I tell you what I do. That? I don't know whether this is indicative or not. I personally take less than 1 ounce a day.
Okay.
So, and I am 170 pounds. So I think that for a child, you make the ratio with the body weight, a teaspoon maybe, you decide. And then, of course, you see how he reacts. You know, this complex microbiota that is in our probiotic has to interact with the existing microbiota, and my microbiota is different from yours. So you have to start with the low dose.
Mm-hmm. Yeah, okay, thank you.
Thank you.
Hello. I was wondering if you could elaborate on how the phages, how do you say it, phages, how they modulate the antibodies. And do you mean autoantibodies like what you see in Hashimoto or type 1 diabetes?
Well, this is a very important question. Let me tell you first of all that this approach has proven effective in autoimmune diseases because we have to be careful. I never spoke about stimulation of the immune system, but I always spoke about modulation of the immune system. Because of course, if you non-specifically stimulate the immune system and you already have an autoimmune disease, and there is an autoimmune component in autism, we know this, you do much more harm than good. Modulation means that kind of an adaptogen, that is, you decrease what is too high, you increase what is too low. Now, since this approach is completely natural, actually, we have not invented anything, we have simply tried to copy nature. This approach leads to modulation. So we have clinical evidence that this approach has led to significant improvement in autoimmune conditions from lupus to skin conditions like pemphigus to other conditions. And we have evidence that it has helped with autism as well. Modulation of antibodies production means essentially that you have enough antibody production when it is needed, not too much when it is not needed. I know that the next question will be how will it interact with vaccines, and the answer is we don't know because of course nobody has done any study doing with or without vaccination, with or without probiotics, but in general terms we may say that remodulating the immune system through natural ways should help.
Hi, I have a child that was diagnosed with PANDAS, did high-dose IVIG, 6 months later had symptoms, which then was diagnosed with brain cancer. And then now he's 4 years out from finishing treatment for brain cancer and doing very well, with the exception that he still has some mild PANDAS symptoms and now the late effects from proton radiation to the brain. And I saw that with, I know that there's EMF that damages DNA, but is this something that could possibly help with direct damage to the brain from proton radiation?
Well, let me divide your point in two, because you mentioned 2 points.
Right.
As far as PANs or pandas are concerned, we know for sure that our approach is helpful for a very simple reason. Our microbes, when I say our microbes, I mean the microbes in our probiotic, they want to go and kill the other pathogenic microbes for their own purposes. So they produce natural antibiotics. Not only this, the phages that are beneficial for them are detrimental for the pathogenic microbes. So that's why they are instrumental in fighting chronic silent infections. So as far as the pandas side, I would say with no doubt. As far as the damage inflicted by the electromagnetic fields on the brain cells, this becomes a little bit more complicated, because the microbes of ours have to go to the brain. Now, we know that there is a recirculation of microbes from the gut to the brain and back. This was completely unknown until 2016. Then if you go to PubMed and look for brain microbiota, you will find that the first paper published in PubMed is by myself, and from there now it is common knowledge that we have microbes in our brains as well. Where do the microbes in our brain come from? From the gut. How do they go there? Through the lymphatic system. So if you wanted to maintain a good balance between the microbes in the gut and in the brain, and of course you want to have good microbes in the gut, so to have good microbes in the brain, and then you want these microbes in the brain help fixing DNA damage, you have to have a good circulation of lymph. I think that Dr. Antonucci, Dr. Klinger will talk about lymphatic blockade, how you can remove the blockade at the level of the cervical nodes. So the answer is, in line of theory, yes. However, it won't be as easy as just drink a little bit of yogurt and everything will be fixed, because it requires a whole approach, a holistic approach.
Okay.
Thank you.
Okay.
Oh, if you have another one, I think we have only one person in line, so, and we still have 6 minutes of time.
I just wanted to ask, so in a holistic approach, do you have any other suggestions of what you would add according to that? Because, I mean, my son does work with like 6 different integrative doctors. So I mean, I don't know if there was something that you had in mind.
Well, you know, this would require like an individual assessment.
Okay. Yeah.
Then my best suggestion is to ask Dr. Klinger or Dr. Antonucci, who have a vast experience at treating patients. And because, as I said, last patient I saw was in 2013, and ever since I've dedicated all my efforts to research and development. So ask the real doctors.
No, thank you very much. I appreciate it.
That will be better. Have you seen any beneficial effects of either of these products on children or adults who have anaphylactic food allergies?
Well, it depends what type of anaphylaxis are you talking about. In general terms, and this refers to all probiotics are helpful in decreasing the symptoms of food intolerances and allergies in general, and this makes full sense. Then it depends, again, which type of anaphylaxis are you talking about. Let's say that in general terms, the answer is positive. Then, since its inception, we devised different ways of delivering these probiotics. So now we have products that are based on milk, so you end up with something that looks like a yogurt, but since we know that in many cases dairies, caseins, lactose are not recommendable for a number of conditions, we have devised a way to have the same 300 some microbes in non-dairy matrix. So you can have like a fruit juice, apple juice, or coconut milk or almond milk with the same microbes. So different ways. Together with Dr. Klinger, we developed a cream that contains the same microbiotics, so another way to skin the cat, poor cat. So from the outside, working through the interstitium, you can go and take a look at my lecture last year. So general terms, the answer is yes, but then it has to be tailored to the individual condition.
Well, in specific terms, have you ever seen anyone with a peanut allergy lose their allergy?
I don't remember, but again, my point of observation is very limited because I don't see patients. So maybe Antonucci or Klinger have seen them and they have not told me. That's good. I mean, they cannot tell me whatever they see. So my personal answer, honestly, is not. I have not seen it, but I could not rule out that you might see an improvement.
Thank you.
You're welcome. I think we can take the last two quick questions, and then it will be my pleasure to introduce Dr. Antonucci.
Hi, thank you so much for your talk. And I'm curious about the chelation when it comes to the autism. A lot of parents say that that really helped. I understand that your research might not be directly related to that, and that's perfectly fine. But if you, just from your experience or maybe even intuition, could tell us a little bit more about that, what you think about it, I'd really appreciate that. Do you think that kind of rhymes with the probiotics that you're doing with?
Well, we know, and actually we published this 2 years ago, that many of the microbes in our probiotic approach, they bind with what is called instantaneous kinetics toxicants, and they eliminate these through the urines mostly, and the lipophilic toxicants, they are made water-soluble and eliminated. If you go and take a look at that paper that I show you, that referred to a cancer patient, you could find that before this approach he had very, very elevated levels of a number of toxicants, including Agent Orange, number of lipophilic like dioxin, benzene, number of things, because he had been exposed for professional reasons. And after he began this approach, the amount of these toxicants eliminated through the urine was incredibly impressive. So here there are several mechanisms at work. One is a physical binding, the other is improvement of the body's detoxifying properties. Whatever the case, there is a net decrease of toxicants following this approach.
But just in terms of chelation itself, or aside from probiotics, do you have any stance on that? You know, there's some controversy.
No, I'm not an expert on chelation, so the chelation I'm talking about is the natural one that occurs with probiotics, but I have no experience with the EDTA or EGTA or these things.
Understood. Thank you so much.
Hi there. Thank you for your research. Can I ask you a question in terms of for a pregnant woman who already has had children on the autism spectrum, if she's pregnant at the moment, is this treatment okay in her pregnancy?
Well, now this becomes very difficult to say because every pregnancy is different. In general terms, a probiotic approach is completely safe during pregnancy unless there are specific contraindications. However, one point that may be interesting is that we already have tools to assess the predisposition to the development of autism in children very, very young, 6 months old, something like this. So by using the transcranial ultrasonography, we can assess whether a child, usually we're talking about siblings, whether the brother or sister of an autistic subject has predisposition to autism. If we find accumulation of lymph or if we find enlarged lymph nodes, again, all things that are very easy to be detected, they're harmless, inexpensive, then we can preventively apply strategies to prevent the onset of the symptoms by favoring lymphatic circulation and so on. So to answer your question, I do not personally see any contraindication in taking probiotics during pregnancy, but again, check with your doctor, don't take my words for good. And we are devising strategies for the very, very early diagnosis of the predisposition to autism with the goal of preventing the onset of autism.
Just to follow up with that, if a child does have to be on antibiotics at birth or within the first 6 months, would you suggest this therapy then to offset the detrimental effects of that?
Well, antibiotics, they kill all microbes, good and bad. Sometimes you have to take antibiotics because I do not recommend of dying of pneumonia to save the microbiota. So, but antibiotics, of course, are not specific, so they kill all the microbes, the good and the bad. Good thing is that you can replace the good microbes with a good probiotic. So if a child has been exposed to antibiotics, and this is old assumption. When I was young, after the antibiotic therapy that usually in those days lasted 6 or 7 days, they gave us the lactic ferments of those days. Primitive but effective. So yeah, I would say definitely so. Well, thank you so much. I don't know if Dr. Antonucci has already downloaded his presentation. Not yet. So while he does this with the help of our technical staff, I thank you again, and it is my pleasure to introduce Dr. Antonucci. So let me see if I'm able. Thank you.